Hello, hello again. This is Jorge Briones with your show, What in the Health? What in the Health, Arlene? Today we have a wonderful guest as well. Dr. Berger with WellMed is here in the cabin. She's going to talk to you guys about what's going on the world of Medicare with the physicians that are involved in your healthcare. Dr. Berger, how are you today?
Hi, Jorge. I'm very good. Thank you for having me. This is a lot of fun, and it's my first time on a podcast. So
right.
I'm really
well,
excited.
we're gonna make it fun, doctor. We're gonna make it fun. And again, sometimes I get a little overwhelmed, but you know what? That's gonna be the fun fact in this. So it's well known by everybody that we are in the last week of the annual enrollment period. This is the time. Well, actually, start October 15 and December 7 is around the corner. And during these 7 weeks, we pretty much had the opportunity to help a lot of people evaluating, review their benefits, and of course, connecting with physicians, connecting with providers that will pretty much improve what's going on everybody's health, right? So with that being said, Dr. Berger is here to talk about what is that importance for you guys to be the ones that are on Medicare, the ones that are actually listening on the live video or hearing the podcast or just following us on the social media. Like, for example, how vital is to know what's going on with your plan, with your health, and also, establishing that connection, that relationship between patient/member on a Medicare plan with your doctor. So with that being said, Dr. Berger, tell us a little bit about yourself.
Thank you, Jorge. So I born in the States. My mother is from Mexico,
Oh,
so
wow.
I am half Mexican.
There
My
you
father
go.
is from here.
Okay.
So I, grew up here in Houston. Did my medical school training in Guadalajara, Mexico.
Oh, wow. Look at you.
Yes. So I have the best of both worlds, I think. I learned so much there, got a lot of hands-on training.
Okay.
I'm fluent, obviously, in both languages.
Oh, wow.
So I learned my medical terminology in Spanish first, had to learn it in English. But it's been a wonderful experience. So this allows me to see patients that speak both languages.
There you go.
I primarily see patients, obviously, as you mentioned, that are Medicare Advantage eligible, 65 and up.
Okay.
I do see some patients that are younger than that, but primarily geriatric patients. And our goal, yes, is to treat always as physicians, but in primary care, we really want to try to prevent illnesses from occurring or prevent them if they're already present from getting worse. And so, my dogma's always been treat my patients as my family.
There you go.
As if they were my family. And I try to make sure that they feel that way, that they feel they can trust me and ask me whatever it is they feel they need to ask, and just build that trust.
That is I guess the key ingredient whenever we basically, it's well known, JWB, we're brokers of insurance. Our forte, our main thing every day pretty much is to help folks with Medicare plans. We want to make sure that everybody's getting every single aspect of their coverage, healthcare wise, medications, extra services available into that structure of what's going on their plans, right? But at the same time, doctor, it's a common factor. It's a common thing that sometimes, what is it called? When we approach seniors, they say, you know what? I don't like my doctor, but hey, I go because my plan give it to me, right? Mm-hmm. So, that stigma, it happens because sometimes there's not such a relationship between the member and the doctor. Before it was like, okay, well, you be here in 5-10 minutes and then I'm going to give you a prescription, go to the pharmacy, right? But that actually made a big hole because now seniors don't think they're worth the time of their doctor. And sometimes they don't want to go to the doctor, right? Mm. And that's why I guess you come from the fact that the institution you represent, that we're going to say in a little bit, mm-hmm. you are actually providing that extra help or extra services, right? So tell us a little bit about, where do you work, Dr. Berger?
So I work at WellMed at St. Joseph. WellMed has
downtown, right?
Correct.
There
yes.
you go.
So we have patients coming from far and wide.
Yeah.
Some patients live in the vicinity. Some patients make the journey to see me.
Yeah.
Just because they want to keep seeing me.
Yeah.
And the good thing about WellMed is they have a lot of services that help seniors with their daily living, whether it's keeping them out of the hospital, helping them with meals on wheels, social workers that can help if they're having housing problems, or but primarily our focus is we want to keep patients out of the hospital.
Absolutely. And that's one of the things, folks, that, especially for those that, again, our passion, our dedication is to help our seniors living a better life, and also, help them get those services that sometimes they don't get, right? Mm-hmm. And like you said something that actually triggered something on my head, like in the same way that I work with so many partners, as well know, JWB, we have multiple partners, but we strategize with the ones that we believe on. And as well as we believe in the WellMed model, we believe in some other companies as well. But one of the main things that I strive to say at all the time is, again, what we're going to do every time we're in front of a person, in front of a member, is we're going to try to get that extra that they're not getting. And something that you said is very important. Patients will decide to follow you as a doctor, because even though if you move from a location, they're going to say, you know what? My doctor helped me saving money on my medications. My doctor helped me, stop my insulin, or my doctor helped me in a way that I was not helped before. And that is something that I see a lot lately, especially in clinics like WellMed, because WellMed is specifically help preventing those situations, like say, hey, we're going to keep you outside the hospital, right? But at the same time, doctor, tell us a little bit about that senior care model that the clinics at WellMed have, specifically for anybody that is on a Medicare plan.
So we have availability, number one. So a lot of patients, as I'm sure you've seen, they want to see a doctor, but the doctor's busy, the doctor's booked. Usually I have an open door policy.
Okay.
I'm always available. I also have a couple of nurse practitioners that work with me, and most of the clinics do as well. We have our physician that leads the clinic, and then we have nurse practitioners that help us. And so, we always want to make sure the patient knows there's someone there for them.
Okay.
We usually have them in and out quickly, so they're not waiting a long time.
Yeah.
There are medication assistant programs that WellMed is affiliated with, to help them get some of those prescriptions that they're not able to afford.
And one of the things, again, I believe is what specifically, I know what you're trying to say, but the thing is, like, WellMed will dedicate the time and the energy, if I'm not mistaken, to pretty much assist anybody that is on an emergency situation that, let's say, for example, I'm not feeling well, I don't want to go to the ER, I'm going to call my doctor because my doctor will listen to me. That open door policy that you said that you have at the facility that you work at pretty much will give that to them, right?
Correct.
Now, I'm sorry to interrupt, Dr. Shaw. One thing that I like to everybody know is, like, for example, right now, nowadays, there's so many clinics, so many places that people can go with Medicare. But at the same time, they have to realize that as much as they want to do for the seniors, if the seniors don't open themselves to get that assistance, there's nothing you guys can do, right?
Right. Yes, I mean it's a team. We work together, patient, physician, or patient nurse practitioner. So yes, once they call the office, once they take that first step, we'll schedule them. We'll get them seen, get their labs done. See what preventative studies need to be done. Prevention of cancer, breast, prostate, lung, colon. Yes.
It is pretty much a connection that, you guys will, like you said, prevent them to go to the hospital, right?
Yes.
Now on the WellMed model, okay, so, everybody knows the WellMed clinics are pretty much everywhere in Houston. You are in the St. Joseph location, specifically downtown, right?
Right.
Now, let's say, for example, I know this for a fact, whenever members cannot get to the doctors, you guys offer, telehealth, or what is it called, the virtual visit?
So we have telemedicine visits, which is video. So from their phone or iPad, I will see them. They can see me, address what they need.
Okay.
There's also dispatch health. That's a service that we can call to have a provider go to the patient's home.
Oh, wow.
If they're sick.
That is value.
Yes, yes.
That is
And
value.
again, if it's they can do blood work, urine, again, trying to prevent them from having to go to the ER. We also do home visits for patients that aren't able to come in.
Okay.
This is patients obviously that are bedbound, advanced illness.
Yeah. Wow. This is incredible because like imagine to have the power to say, hey, Dr. Berger, I cannot come because I don't have transportation. There's some ways, and also like for example, like you said, these chronically ill patients, you guys come to them. That is unreal. That is amazing. Actually, that if you are listening to the live video or you following us on the social media platforms, if you know somebody that is, struggling to see a provider, a doctor, any type of, healthcare per se, because of these conditions, the guys at WellMed can help. And one of the major things that I actually, I consider myself picky. Every time that I work with a provider, with a partner, I actually say, you know what, the same way that the provider give us as agents, as agency, an audition. I call it an audition. You guys can work with everybody, but at the same time, if you don't believe, it's not going to work, right? It's like a marriage. If you don't understand each other, hey, this thing is not going to work, right? But at the same time, one of the things that I follow and I believe in what you guys do is that, like, for example, the fact of being available, the fact of that the doctor is going to take the time to say, what's going on? Hey, I heard that you don't feel good. And it just happens with you. I'm going to say, I'm going to brag it. I have sent couple of my members to you. I have sent couple of my members to every other WellMed clinic that I work with, and none of them have said to me, hey, change me from this doctor because I don't like it. Actually, they said, where these people have been all the time, But that's what I'm saying. That's what I believe, that sometimes the stigma of the seniors specifically, they don't think the doctor will care for them, and unfortunately, it's a reality. It's a sad reality. The seniors don't think they're worth anymore to anybody, including their doctors, and sometimes that actually increase the risk for them to have any other type of illnesses. So, Dr. Berger, for example, what would you say if somebody that is not on the wellness structure, right, but would like to learn about it? What do you think it will be the best approach to somebody that is on the live video or whenever we do our digital campaigns? Like, for example, want to learn a little bit about WellMed. How can they get information? Or, for example, of course, we're the first ones out there in the field saying, hey, if you don't like your doctor or you're not happy with your doctor, go check Dr. Berger at St. Joseph, or go check Dr. Garcia in East Mount Houston. Go check everywhere. These people are everywhere, right? But, like, for example, what would you say if somebody's curious about the WellMed model? What do you think it will be the best way to do?
Well, if they're interested in seeing a primary care doctor, the quickest way I would say is just to search online the closest clinic.
Correct.
And call that clinic.
Or give us a call too, because we can walk you through the options and access, for based on your zip code. We can say, hey, Dr. Berger is around the corner from your house, or, for example, any other doctor is around to your house. But at the same time, doctor, what exactly are the let's say, can I be a member of WellMed or not?
Yes, you can. So WellMed accepts different insurances, and you're an expert in that arena, more so than I am. But I see Medicare Advantage, but the other clinics, I don't know if they specifically see what insurances each of them see or don't see. But I do know we accept both commercial Medicare and Medicare Advantage.
Correct.
So, if they're not insured to begin with, I would definitely recommend talking to a broker like yourself, because, that'll help get them plugged in. Probably,
absolutely.
More quickly. and if they don't, they can always call us and we can point them in the right direction.
Absolutely, absolutely. And one of the things that I like about it is that you're right. So the connections that you guys have established with the major carriers, I understand the main ones that you guys take is WellCare and United Healthcare, of course, a few other ones, but at the same time, you guys are very well situated with every single one of the benefits these folks need at the end at the end of the day, whenever they come see you. I like the fact that, whenever you guys have a patient in your WellMed network and your WellMed structure, you guys take care of everything, referrals, and pretty much I know you guys were in a different clinic, not specifically you, Dr. Berger, help one of my members finding a specialist to treat that condition they have. So to me, that is value, because as an agent, as an ambassador, to say, hey, if you're not happy with your doctor, if you're not happy with the place that you go to seek health care, go check these folks. They're going to take care of you. One last thing, doctor, is like, for example, in case that, let's say, somebody wants to come see you or the location that you work at, what would you say that phone number will be?
My phone number at my clinic
Your clinic?
832-366-1305.
There you go. And that's going to be for the San Joseph Clinic that is off of
St. Joseph Parkway in Austin, right next to St. Joseph Hospital.
There you go. Right next to the San Joseph Hospital. So you guys, if you are curious about what is going on in the world of, insurance, or for example, if you guys want to just check it out, what is all WellMed about, I strongly encourage you to guys give them a call, or just give us a call. JWB Insurance Agents, we will be able to walk you through the process. We will be able to, introduce you to their facilities, to their models, and why not saying introduce you to a doctor like Dr. Berger that will pretty much establish that connection from day one to pretty much understand what's going on with your health, what's going on with your medications. At the end of the day, what we want to pretty much remark is you guys have the power to say what you want. At the end of the day, we want to say you guys have the power to pretty much seek for a better opportunity on your Medicare plan. Because remember, every year is a change, and 2023 is around the corner. Today is December 1st. We are at 7 days exactly from the last day of the annual enrollment period. If you have not checked your benefits, or you're still wondering what's going to happen in 2023, hey, still have time. There's a lot of people calling. There's a lot of people inquiring about what's going on the plans. So if you have not anybody evaluating your benefits, give us a call. If you're not satisfied with your doctor, give us a call, because at the end of the day, you guys can get into this wonderful system like WellMed clinics are, knowing doctors that really care for the seniors' health like Dr. Berger does. And at the same time, we want to have the opportunity to walk you through these services. Doctor, something else that you would like to say before we end it?
Yes, just, at the end of the day, as physicians, I feel we're here to serve. We're here to serve, and we want to remove suffering and prevent it, preferably. So if you feel like you need to see a specialist, a physician, and you need a primary care physician, I'm here. I'm a resource. Jorge's a resource. And yes, WellMed is open to everyone. So
yeah, give them guys a call. Again, what's your office, doctor? Your office phone number, doctor?
My number is 832-366-1305.
There you go. At the same time, if you guys want us to help you with your Medicare plan or checking out what's going on 2023, please, you still have time. Give us a call, 281-743-8691. My name is Jorge Briones in your show, What in the Health? Thank you so much. Until next time.